We are all here today to discuss the toxic drug and overdose crisis on the implementation of BC's exemption under the Controlled Drug and Substances Act. The effects of this public health crisis have devastated communities across British Columbia and across Canada. Collectively, through harm reduction and treatment services, as well as prevention efforts alongside all orders of government, we are working in tandem to try and save lives. Despite these efforts, the situation has never been more urgent. Since 2016, more than 30,000 people have died of an overdose in Canada, with 2021 being the deadliest year to date. And according to the most recent national data, there were approximately 20 opioid toxicity deaths per day in the first 6 months of 2022. Here in British Columbia, the epicenter of this crisis, 2,267 lives were lost to illicit drug toxicity in 2021, the highest recorded death toll in a calendar year. And in the first 9 months of 2022, 1,644 lives were lost to illicit drug toxicity in the province. As we all know, there is no recovery for someone who is dead. Last May, I announced that our government had approved an exemption request from the province of British Columbia so that adults 18 years and over in the province found in the personal possession of up to 2.5 grams of certain illegal drugs for personal use would not be arrested, criminally charged, or have their drugs seized. Tomorrow, that exemption comes into effect, marking a monumental shift in drug policy that favors fostering trusting and supportive relationships in health and social services over further criminalization. Through this exemption, we will be able to reduce the stigma, the fear and shame that keep people who use drugs silent about their use or using alone, and help more people access life-saving supports and treatment. As we were clear last year, this exemption is not legalization. All activities with illegal drugs, including production, trafficking, import, and export, remain illegal, even if conducted with the drugs listed in the exemption in amounts under the 2.5 grams threshold. I will also assure you that since announcing the exemption, our government has been working with British Columbia as they put in place measures to support successful implementation, including law enforcement guidance and training, and increasing the health and social service supports. Together, we will work closely to evaluate and monitor its implementation to ensure that this exemption continues to meet public health and public safety objectives, and to help inform Canada's comprehensive approach to address substance use harms. Although we still have a lot to learn about the impacts of decriminalization, it is our collective hope that this exemption will help reduce the stigma related to substance use, increase the access to health and social services, and decrease the harms related to criminalization, and ultimately save lives. We know that access to treatment remains a gap, and we are committed to working with provinces and territories to ensure equitable access to treatment and support for a healing journey that is trauma-informed and culturally safe.
As many of you know, we're all here to talk about the approval in May of Health Canada's approval of BC's exemption request to decriminalize people who use drugs. And under this exemption, people found in possession of a small amount of certain illegal drugs for personal use will not face criminal charges, fines, or have their drugs confiscated. Instead, they will be offered information about health and social supports, local treatment, and recovery services. Instead of being treated as criminals, they will be treated with care and compassion. Decriminalizing people who use drugs is a critical step in tackling the toxic drug crisis. It will help break down stigma the fear and shame around substance use that prevents so many people from reaching out for life-saving supports. Because substance use is a public health matter, not a criminal justice one. I want to say that this work would not have been possible without the advocacy of so many people in BC. People with lived and living experience have called for decriminalization for years, as have health officials, the Union of BC Municipalities, and both the Canadian and British Columbia Associations of Chiefs of Police. And I am so grateful for the voices of people like Dr. Henry, who have shown bold leadership and without whom we would not have gotten to this day. Decriminalization also has received the support of all parties in the legislature. And to inform and to prepare for this critical step, it took leadership from a diverse group of partners, members of our core planning table who worked together to reach this point. And this table is made up of people with lived and living experience, law enforcement, Indigenous partners, public health experts, municipalities, and advocacy groups. And for the past few years, they've been playing a vital role, including helping to develop BC's application to Health Canada. Their voices have helped shepherd us through this process, and we will continue to rely on them as we implement, evaluate, and monitor decriminalization across the province. It has been a long road to get to where we are today. For the past several months, we've been preparing to implement decriminalization. We've built new pathways into the healthcare system by investing over $11 million to hire really substance use navigators in all health authorities. And these are individuals who will be on the ground dedicated to connecting people who use drugs with the help they need and deserve. We've also worked with police leaders across the province to develop a range of training resources and guidance. And so far, more than 2/3 of police officers across the province have taken this training and are ready to implement decriminalization on the ground. And we're rolling out a broad public information and education campaign on digital platforms, on social media, radio, and Google search. Of course, one of our top priorities is to ensure that young people are protected as we implement this exemption. And we want parents to know that we are always discouraging youth from experimenting with drugs. And we want parents to know that we've developed resources about decriminalization to support them and educators and school staff when they are talking to children and youth about drugs.
It's a momentous day to be here, and I'm very pleased to be here with you and to thank all of our partners who contributed to today's announcement. As many people in this room may know, in April of 2019, I released a report urging government to consider the decriminalization of people who use drugs and have been advocating for that ever since. We know that this is a complex problem and it requires comprehensive, multifaceted approaches. And this is one of those important steps that we can take. We know that criminalizing people who use drugs causes harms and does not, as we are absolutely sure, decrease the use of illegal drugs, and we've seen that, the impact of that across this province in particular, with the toxic drug deaths that have continued unabated and worsened over the period of this pandemic. Last May, I was there as the provincial and federal governments announced that BC had received our 3-year exemption to decriminalize personal possession of small amounts of some illegal drugs for personal use. And I'm very grateful to be here today as we announce that starting tomorrow, people will not be arrested or face criminal charges if they have up to 2.5 grams of certain illegal drugs for personal use. And as has been said, there are many options that we have now, but really what this is about is taking it out of the system where people have to have interactions with the police, and that's important. And it's also important for people who use drugs, their loved ones, their families, their friends, who work hard every day to help people, to humanize and support people who use drugs, because they are our family, our friends, our neighbors. The stigma and shame around using drugs often means that people don't reach out to their friends or their family or their health professionals because they're afraid of the stigma that they're going to face. It drives people to hide their addictions and to use alone, and in the environment we're in right now, that means that many people are dying alone. And I hear that from families all the time. Today's announcement is an important step to help remove the fear and the shame and that stigma, and allows people to have open conversations that we can help people understand their drug use and reach out for the services they need. We hope this will help people feel safer about getting those life-saving services and programs and talking to their friends, talking to their healthcare provider, and help our healthcare system in keeping people alive and connected to the health and social supports they need. It will not be perfect, and it's not going to change the crises that we're dealing with overnight. But it is a philosophical and an important step that helps us take that next work together to make sure that we are doing everything we can and that there are many different streams that people can follow. We will be adjusting as we go, and I know there's lots of questions about details and what data we're following and how we're going to measure this and the 2.5 grams. Those are all the things that we will be working together to follow, to understand the impacts on public safety, to understand the impacts on people in our communities and our families across this province. More still needs to be done, but this is a really historic and important step. And I look forward to continue working with Minister Whiteside and Minister Bennett and all of our partners as we implement this and as we weather the challenges that we're going to face over the next few years. And I know this will make an important difference in people's lives.